Hello, my name is Rachel and I work at Step 2 Young People's Health. This video is about contraceptives. Before we start, we'd like to say thanks to our friends at Brook. On their website they have some absolutely fantastic teaching resources and some aids to show different types of contraceptives and their effectiveness. So just a little explanation of conception and contraception. Conception is when the sperm meets the egg, and contraception is the deliberate use of an artificial method or other technique to prevent pregnancy as a consequence of sexual intercourse. So conception, sperm meets egg, baby created. Contraception, method used to stop that from happening. Okay, so different types of contraceptives. If conception has already taken place, these are all absolutely useless. Some of them are more popular in the UK than others. Some of them have historically been very popular but aren't anymore. And it does kind of depend on you, on your age, on your partner, on your relationship, and on the reason that you're taking them. Not everybody takes some of these for contraceptive reasons. So you've got the contraceptive pill, a male condom, diaphragms. I'm not going to go into any detail during the video about diaphragms. They are inserted up into the vagina. They are not used a lot in this country now, but if you want advice and guidance on that, a sexual health clinic can provide it. Contraceptive patch, same. I'm not going to go into any level of detail with that. You can see it just looks like a plaster or a nicotine patch. You've got the IUS and IUD. They're sometimes known as the coil. Now, I don't have information on that one in this video simply because we are a young people's health charity and they're not really recommended as contraceptives for young people. However, if you do want information about those, I can signpost you where to go for those. Internal condoms. We do have another video on our channel about which condom should you use, and it does include information about both types of condom. Implants, I'm going to talk about those in a sec. Injections, same with that. Sterilisation is effectively permanent, so that is surgery. You might have heard of it as getting your tubes tied or getting the snip, and that's about preventing future pregnancies through surgery. Natural family planning, I will talk about that. That is one that is favoured by a lot of people who are of faith and don't believe that you should use any kind of barrier. You know, if it's God's will that you'll get pregnant, then that is God's will and you shouldn't try and stop that. Not everybody believes that. They use it for other reasons. But this basically is planning your cycle. It needs to be done with a medical professional to get it right because it can be a bit of a challenge. So you have to plot the days of your menstrual cycle, as you can see on the chart there, but you also have to plot your daily temperature, but you have to do it at exactly the same time every day. There's other things that you've got to take into account as well, and it's basically about working out when in the cycle you are ovulating, you're producing an egg, releasing an egg I should say, and that is the time of the month where you are at your most fertile and you should avoid having sex. And it's about looking at when else in the month is a bit safer, so it might be a more suitable time for you to have sex. It's not like those period flow trackers that you get. Okay, you need to do this with a medical professional first. They're not accurate enough. If you do want to do natural family planning, the percentage effectiveness can be up in the 90s if you get it right and you work with those medical professionals. I'm going to go on now though to talk about some of the artificial methods. So the most common forms for young people are these ones. You've got the contraceptive pill, you've got the implant, you've got the male condom. Female condoms not as common in the UK. They are making a little bit of a resurgence, as you'll see on one of the other videos, but they're not as popular, certainly not as popular as male condoms. And the contraceptive injection. So one at a time. Contraceptive pill. Just going to put everything up and talk through it. So these do have a very good level of effectiveness. No contraceptive is 100% effective because it's down to the person that's using it. So if you forget to take a pill one day, it is not going to be 100% effective. It doesn't interfere with sex. You don't have to stop and say, excuse me, love, just give me a sec. They are very widely available. I'll talk about that in a little bit. You don't get any protection from STIs with it. You do have to remember to take it. You could set a reminder on your phone, but if you're a little bit forgetful, okay, this might not be the right one for you. If you miss pills, if you vomit, you've got diarrhea, it can make it less effective. They can be used for heavy and painful periods. So some people are prescribed these because they have difficulty with their periods or because they've got severe acne. Not because they are sexually active, but because their hormones are causing issues for them. And with absolutely any medication that you put into your body, there can be side effects. Some people lose weight, some people gain weight, some people get sore breasts, some people don't. There's really no way of knowing until you take that medication. The implant is a second hormonal contraceptive. So the contraceptive pill is hormonal as well. The hormonal ones disrupt the lining of your uterus, of your womb, to make it difficult for an egg to implant into there. So these 99% effective. Again, they don't interfere with sex. Once it's in, it's in. They've got to be done by a trained health professional. So it goes into the top of your arm, as you can see in the picture. And if you've ever had your ears pierced, the gun that they use to just zap it in and it's done, it's very, very similar to that. It's just a quick, sharp pain and then it's in there. To get it back out, tiny little cut, pair of tweezers, out it comes. You should be able to feel it under your skin. Okay, it's not supposed to be deep in your arm. You're supposed to be able to feel it just under the skin. Doesn't give you any protection against STIs whatsoever. For some people, they can cause irregular bleeding. For some people, their periods stop altogether, which some people are quite happy with. You know, some people that makes them worry a little bit. Well, how will I know if I'm pregnant? So again, that's something that you need to talk through with the health professional that's putting it in to see if it's the right one for you. There are some medications that can affect its efficiency, but the doctors will know that. And if you ask for an implant and it's not going to work with some medication that you take, they will tell you that. As soon as this is taken out, your fertility levels go back to normal. So if you're going to be wanting a baby at some point, then you can have this taken out and you should be good to go straight away. And they work for 3 years. So if you're really forgetful and you can't remember to take your pill every day, this might be a good one for you because you don't have to think about it for a while. The injection, again, is a hormonal form of treatment. And it is 99% effective again. It doesn't interfere with sex, again, so you don't have to stop for it. It's one injection, but it's got to be every 8 to 13 weeks. Now, you're not going to know if you're an 8-week person or a 13-week person. It just depends on your body. So that will need to be monitored the first few times you have it. For some people, it can decrease their period pain. It's not affected by any of the other medications. It doesn't matter if you're sick. It doesn't matter if you've got diarrhea. However, for some people, it can cause irregular bleeding. It can change when they have their periods. They could have them more often. They could have them less often. It gives you no protection against STIs, just like the others. It's got to be done by a medical health professional. And it can take up to a year for your period of fertility to bounce back. So if you're thinking, well, yes, I would like to have kids, I'm not 100% sure when, but sometime within the next year, this is not the right one for you. Okay, maybe the implant is better for you. This one, yeah, probably going to have kids in the next 2 to 3 years, so you might be okay to get started with this one. Another issue with it is, if the pill's making you ill, you stop taking it. If the implant's making you feel rough, you get it taken out. Once this injection's put into your body, it can't be removed. You've just got to wait for it to wear off. So if you don't like the side effects that it's giving you or that it could give you, then again, perhaps this isn't the best one for you. And it's injected into your bum cheek usually. Okay, so you might want to make sure you're wearing a nice pair of pants when you get yourself to the clinic. It has to be said that at the moment, the 3 that I've mentioned are all for ladies. Okay, so these are taken by the women. That does not mean that contraceptive is just a woman's responsibility. Okay, it is both people in that partnership's responsibility. Okay, so this is the external condom or the male condom. Putting them on does interrupt sex. You do have to say, hang on a second, I'm just going to put a condom on. Okay, but if you've had a little bit of practice and you've watched our video about which type of condom is the right one for you, okay, then you should know what you're doing. They're easy to get, they're free for young people. If you're up to the age of 24, you can go to a sexual health clinic and get them for absolutely nothing. They do protect against STIs. They're only needed when you have sex. You don't need them any other time. You do not walk around with a condom on if you're not having sex. These are obviously for the men to wear. They can sometimes tear or slip off if not used correctly. Again, that comes down to size, and that's something I've spoken about in one of the other videos on our channel. Some people are allergic to latex, but there are latex-free condoms that are available. They come in different sizes, textures and flavours, so the sizes are really important. Textures are just for a little bit of fun. The flavours are for if you're giving somebody oral sex and you want to protect against STIs, then you can use those. Male condoms. On the packet, so this is the back of a condom packet, you can see the British Standard mark and the CE mark. They are to say that they have been tested in a factory, they are up to standard, they are safe to use. They are basically legit. They are going to work, they're going to be fine. Okay. You can get cheap and nasty knockoffs, okay, as with most things. They will not have those logos on and there is no guarantee in the quality of them. There's also a use by date on the back of the packet, and you can see there that one says 2026 12, so that's the year followed by the month. They are always year followed by month. If the condom is a month out of date and it's the difference between you wearing one and not wearing one, wear it, but be careful. Okay, if your condom is a couple of months out of date, bin it, get some different ones. Okay, they dry out, they go a little bit like an elastic band that's gone all dry and crusty and splits. Make sure you're checking for any rips, tears or holes in the packaging before you open it, okay, because if there's holes in it, it's absolutely pointless using it. We will be putting another video up on our channel that shows a condom demonstration of what you need to look for on the packet and how to open them. That's quite important too. Please don't use your teeth. Okay, so this is not a form of everyday contraceptive, but I think it's an important one to include. The emergency contraceptive, also known as Plan B or the morning after pill, will not cause an abortion. If conception has already taken place, if the sperm has fertilised the egg, there's absolutely nothing that any of these things are going to do. Okay, this will not cause that pregnancy to end. This is for if you've had unprotected sex or the condom has split and you need some help and support with that. 98 to 99% effective, no protection from STIs, so if you have had unprotected sex, it might be wise to get an STI test as well. They can be used for up to 5 days after unprotected sex, and they are widely available. You can purchase these as well. You can buy them for between £28 and £35, but if you're under the age of 25 and you go to a sexual health clinic, they will give you these for free. So this will stop a pregnancy from being able to happen. It will not stop a pregnancy that has already started. Okay, so step 2 is who I work for. We're up the top there. We work in partnership with James and Hale to deliver relationships and sex education across Bradford. You're very welcome to follow us on social media, to ask us any questions that you want to, that you might be too embarrassed to ask anywhere else. We're not bothered, we're not shy. Please ask us your questions, we love it. Okay, Locala run the sexual health clinics in Bradford. They have a chat facility that you can use. You just text that number in the bottom right hand corner. Bradford and Airedale Sexual Health, their website's brilliant too. And if you're over 16, you can order things on the SH24 website.